Assalamu alaikum, good day. This is Dr. Marwan here, representing my group from University Sultan Zain Al Abidin, Faculty of Medicine. And our participation is in this innovative medical teaching tool under the title of Visual Case-Based Approach to Diagnosing and Managing Pulmonary Embolism. The history starts with a middle-aged woman that was visually illustrated as presented with a chief complaint of chest pain and dyspnea with hemoptysis for 1 hour duration. Her history was significant for long-distance flight, which was followed by an ignored painful swelling in her right lower leg. Now, on examination, the patient was found in distress, obviously tachypneic, with an oxygen saturation of 88%. Now, the first turning point comes with the differential diagnosis at this stage of 1 to 5 points, while the ECG that follows that shows an abnormal pattern of prominent S wave in lead 1, prominent Q3 and inverted T3 waves in lead 3. This narrows or limits or shifts the diagnosis even before the imaging confirmation by computerized tomography of the pulmonary artery, and this represents the second learning point and takes us to the third learning point, which is linking the clinical findings with the pathophysiology of deep vein thromboembolic phenomenon, which represents the fourth learning point. And then the fourth learning point is to understand the pathophysiological mechanism underlying the dyspnea and the hemoptysis, what happens really before the patient starts suffering from the hemoptysis. Now this leads us to the fifth learning or sixth learning point, which are the emergency oxygen therapy and the anticoagulants options that can be used. And then the last learning point is about the important blood investigations and self-assessment questions to be answered by the students.
The primary objective of this infographic tool is to enhance early recognition, understanding of the pathophysiology and emergency management of pulmonary embolism using infographic enhanced clinical case scenario modeled on a typical real-world clinical presentation. The novelty lies in that this tool is unique in its synthesis of infographics, schematic ECG interpretation, anatomical illustration, and treatment algorithms into a single, clinically oriented case study. The innovation lies in its dynamic visual storytelling, merging diagnostic, pathophysiology, emergency management, and visual learning principles to simulate real-time clinical reasoning. The usefulness is that this product is applicable across undergraduate and postgraduate medical education, emergency simulation training, and digital content for e-learning platforms. This experience is enriched with embedded self-assessment questions that appear at critical clinical junctures, promoting active engagement and reflecting learning as the case progresses. It enhances engagement, diagnostic accuracy, and memorability of high-risk differentials such as pulmonary embolism. It is also suitable for teaching complex topics during bedside rounds and board review courses. The commercialization potential in this infographic teaching tool is that it can be adapted into an interactive digital apps, printed as clinical handbooks, or integrated into AI-driven teaching modules. With scalability, it holds the potential for licensing by medical institutions, universities, and publishers.
Thank you for listening.